The Eastern Democratic Republic of Congo is facing a humanitarian crisis of immense proportions. A recent surge in violence has exacerbated an already dire situation, leaving a trail of death, displacement, and destruction in its wake. Thousands of innocent civilians have been caught in the crossfire, their lives upended by the brutal reality of conflict. Homes have been destroyed, livelihoods shattered, and a sense of fear and uncertainty now pervades the region. The United Nations estimates that over 700,000 people have been displaced in recent weeks, adding to the millions already uprooted from their homes. These displaced individuals, many of whom are women and children, are now living in overcrowded and unsanitary conditions, making them highly vulnerable to disease outbreaks and exploitation. The recent violence has also had a devastating impact on the region's already fragile infrastructure. Schools, hospitals, and water systems have been damaged or destroyed, further crippling the ability of aid organizations to provide essential services. The breakdown of law and order has created a breeding ground for armed groups who continue to terrorize civilians and hinder humanitarian access. The situation in eastern DRC is a stark reminder of the human cost of conflict. It is a crisis that demands immediate attention and action from the international community. The eastern DRC's healthcare system, already strained by years of underfunding and instability, has been pushed to the brink of collapse. The recent violence has resulted in widespread damage to health facilities, with many hospitals and clinics forced to close their doors or operate with limited capacity. Medical supplies are in critically short supply, and many essential medicines are unavailable. Health workers, already facing immense challenges, are now working around the clock in dangerous and difficult conditions, often without adequate protection or support. Many have fled their posts due to security concerns, leaving already underserved communities with even less access to care. The violence has also disrupted essential healthcare services, including vaccinations, maternal care, and treatment for chronic diseases. This disruption has had a devastating impact on the health of the population, particularly on vulnerable groups such as children, pregnant women, and those living with HIV/AIDS. The collapse of the healthcare system, coupled with the displacement of hundreds of thousands of people, has created a perfect storm for the spread of infectious diseases. Cholera, measles, malaria, and pneumonia, already endemic in the region, are now spreading at alarming rates. Overcrowded and unsanitary conditions in displacement camps, coupled with limited access to clean water and sanitation, have created ideal breeding grounds for these diseases. The lack of adequate healthcare facilities and medical supplies makes it extremely difficult to contain outbreaks, and the situation is likely to worsen in the coming weeks and months. The international community must act quickly to provide emergency medical assistance, including essential medicines, vaccines, and water purification supplies. Failure to do so will have catastrophic consequences for the people of eastern DRC. The ongoing violence in eastern DRC has exacerbated an already alarming food security crisis. Widespread displacement has disrupted agricultural production and supply chains, leaving millions of people without access to adequate food. The situation is particularly dire for children under the age of 5, who are at increased risk of malnutrition. Malnutrition weakens the immune system, making children more susceptible to infectious diseases. This creates a vicious cycle where hunger and disease feed off each other, leading to increased morbidity and mortality rates. The international community must prioritize the provision of food aid, particularly for the most vulnerable populations. The recent surge in violence has forced hundreds of thousands of people to flee their homes, seeking safety in overcrowded displacement camps or in neighboring communities. These internally displaced persons, or IDPs, have lost everything: their homes, their livelihoods, and often their loved ones. Living conditions in IDP camps are dire. Overcrowding, inadequate sanitation, and a lack of access to clean water and healthcare make these camps breeding grounds for disease. Women and girls are particularly vulnerable in these settings, facing an increased risk of gender-based violence, sexual exploitation, and trafficking. The international community must prioritize the protection and assistance of IDPs, ensuring that they have access to basic necessities such as food, water, shelter, and healthcare. The ongoing conflict in eastern DRC has created a climate of impunity, where violence against women and girls is pervasive and often goes unreported and unpunished. Displacement, the breakdown of social structures, and the proliferation of small arms have all contributed to a surge in cases of sexual and gender-based violence. Women and girls living in IDP camps are particularly vulnerable, as are those who have been separated from their families or communities. They often lack access to justice, psychosocial support, and even basic medical care. The international community must increase its support for organizations working to prevent and respond to gender-based violence, ensuring that survivors receive the care and support they need. The World Health Organization, or WHO, is on the front lines of the crisis in eastern DRC, working tirelessly to provide life-saving healthcare services to those in need. WHO is supporting the Congolese government and local health authorities in their efforts to contain disease outbreaks, provide essential medical supplies, and rebuild damaged health infrastructure. Despite their best efforts, WHO and other aid organizations are facing immense challenges in delivering aid to those who need it most. Insecurity, logistical constraints, and a lack of funding are all hampering their ability to reach vulnerable populations. The recent freeze on foreign aid by the United States, a major donor to humanitarian efforts in the DRC, has dealt a significant blow to the humanitarian response. WHO is urging the international community to step up and provide the necessary financial resources to allow them to continue their life-saving work. The humanitarian crisis in eastern DRC is a tragedy unfolding on a massive scale. The international community cannot stand idly by as innocent civilians continue to suffer. We must act now to alleviate the suffering, prevent further loss of life, and create the conditions for a lasting peace. First and foremost, we must ensure that humanitarian organizations have unhindered access to those in need. Armed groups must be held accountable for attacks on aid workers and civilians. We must also address the root causes of the conflict, including poverty, inequality, and the illegal exploitation of natural resources. This is a crisis that demands a global response. Governments, international organizations, and individuals must come together to provide the necessary financial and political support to end the violence and bring lasting peace to the region. The crisis in eastern DRC is a stark reminder of the fragility of peace and the devastating human cost of conflict. It is a crisis that requires a long-term, multifaceted solution, one that addresses not only the immediate humanitarian needs, but also the underlying political, economic, and social factors that have fueled the conflict for decades. The international community must work together to support a sustainable peace process, one that involves all parties to the conflict and addresses the legitimate grievances of all Congolese citizens. This will require a sustained commitment to dialogue, reconciliation, and the building of trust between communities. Furthermore, we must invest in the long-term development of eastern DRC, creating opportunities for economic growth, social progress, and good governance. This includes supporting education, healthcare, agriculture, and infrastructure projects that will benefit all Congolese people. The path to peace in eastern DRC will be long and arduous, but it is a journey that we must undertake together. By working collaboratively and with unwavering determination, we can help to create a brighter future for the people of the DRC, one free from violence and filled with hope and opportunity.